Welcome to Suite 250 at Cool Springs Foot Care. I'm Dr. Lance Reeves, and today we're going to talk about a very common, very painful foot condition, plantar fasciitis. We're not only going to dive into what it is, but also some different treatment options to help you find relief. First thing first, plantar fasciitis is inflammation of the plantar fascial band that starts in your heel and then runs out toward your toes. This can be one of the most irritating foot conditions because this can cause pain with each and every step throughout your day. Plantar fasciitis is caused by many different conditions. One of the most common is an overuse injury. This can mean a patient went on vacation and they did a lot more walking than normal, or they increased their activity, or this can mean a patient just started an exercise regimen and their body wasn't quite ready for that amount of activity. Another cause is poor choice in shoe gear. This could mean the shoe didn't have enough support, the shoe is worn out, or someone was just wearing the wrong shoe for the type of event they were performing in. Biomechanics is another really common cause of plantar fasciitis. Someone with a flat foot type or a high arch foot type can be more prone to getting plantar fasciitis. Another huge factor is having a tight Achilles tendon. If your Achilles tendon is too tight, this can actually alter your gait and cause more pain along that plantar fascial band. Symptoms of plantar fasciitis can be a sharp, stabbing pain in your heel whenever you start walking. This is very common when people get out of bed and take the first couple steps during the morning or after long periods of rest. This is also known as post-static dyskinesia. That's your fancy medical term for the day. This can also present as pain just while you're standing or working through your workday. Now let's talk about treatment options. Again, it's important to consult your healthcare professional before you start any treatment regimen. This is to ensure that you get an accurate diagnosis and a personalized treatment plan specific for what you're going through. The first frontline treatment is just rest. If this is from an overuse injury, your body is going to need time to heal and recover from that injury. Stretching exercises are very important, especially if you have a tight Achilles tendon. This is going to help loosen up that tendon and decrease some of that pressure along the plantar fascial band. Stretching is one thing I tell all of my patients who have plantar fasciitis. If patients are not stretching, then I don't think they're going to recover as quickly as they would if they were in a stretching regimen. Wearing orthotic inserts is very important for patients with plantar fasciitis, especially if they have a biomechanical deformity such as a flat foot. A lot of patients come in saying they don't like their orthotics because they're too soft. However, having something soft in your shoe is not the purpose of an orthotic. The purpose of the orthotic is to support and prevent that arch from collapsing. If an orthotic is too soft, then it's not going to give you the adequate support you need in that arch. Orthotics are a great solution to help reduce pain and actually provide you long-term relief in hopes of preventing that plantar fasciitis from coming back. Night splints are something that can be helpful. To me, this is a tool. This can assist in stretching. A lot of times patients are not able to wear the night splint throughout the night because it can be uncomfortable, but I usually tell people these are great if you're reading a book, watching TV, or just resting in the evening. This way, while you're doing something else, your body is actually stretching by using the night splint, so you're able to stretch and read, stretch and watch TV, doing a couple things at once. Physical therapy is a great option for patients who are struggling with more chronic heel pain or who are not seeing relief with some of their at-home stretching regimens. Physical therapists will not only help with the patient in getting more flexibility, but they'll also help in strengthening the lower extremity as well. In some cases, anti-inflammatory medication may be necessary. Personally, I try to get patients better without using any medications. My goal is to get the patient better without needing to take any pills. I think there are a lot of good treatment options for patients that can avoid any medication. A corticosteroid injection is a common treatment for plantar fasciitis. However, I personally try not to do steroid injections for my patients. One thing I've seen in the past is that after a patient gets a steroid injection, they will feel better, and then it will lead them to do the same activity or an increase in activity more quickly because they have that medicine working. The struggle with this is once that steroid wears off, a lot of times that pain can return just as bad or even worse than before because that patient was really active when they should have been resting. At my office, I try to use different modalities that don't require any injection or any steroid for the patient. I think if we can get you better without a needle stick or a painful steroid, then that's going to be the best route for you. Another great option is shockwave therapy. This uses acoustic pressure waves to help break up some of that painful inflammatory tissue and promote healing. What's so impressive to me about this option is it's non-invasive, requires no surgery, and requires no medication or downtime. Patients are able to get this treatment done in the office and return to their normal activities day of. I think this is a great non-surgical option, especially for patients struggling with this chronic heel pain. Like I said earlier, My goal is to get you better in a non-invasive, non-painful, and non-surgical route, so I love shockwave as a great addition to any treatment plan. Surgery should be the last resort when thinking about plantar fasciitis. This is where you go in and actually cut that plantar fascial band. The thought process here is that if you have that tight plantar fascial band, if you just cut it, you're not going to have that tight band causing pain anymore. For me, I work as hard as I can to get you better without needing to ever get to this surgical point. That being said, if you've been told surgery is your only option for painful plantar fasciitis, I'd love to sit down and talk with you about some other options that could get you better. Plantar fasciitis is a really painful condition, but with the right lifestyle adjustment and treatment plan, I think you can get better and start experiencing relief from that pain. And remember, early intervention is the key to a quicker return to function. So if you're experiencing painful symptoms, don't hesitate to reach out to me. I'm currently accepting new patients, and my philosophy is always to try to work as non-invasive, as pain-free, and as quickly as possible to get you better. If you have any questions related to plantar fasciitis or feel like you may be a candidate for some of these treatment options, please call the office at 615-567-5622 or visit us online at coolspringsfootcare.com. Thanks so much for watching this video. If you found it helpful, please like, comment, and subscribe to our channel.